A friend shared a clip from a movie scene with me recently in which a businessman flying in an airplane is approached by a female flight attendant who asks, "Do you want the cancer?" And the actor played by George Clooney looks back at her and says, "The what?" "The cancer." And of course he looks her square in the eye and says, "The cancer." And now she's visibly upset and annoyed and says, "The sir?" Of course, at this point, he says, "No, thank you, I'm fine." And he moves on with his day. A piece of Hollywood magic and levity and irony, but it got me to thinking about the tremendous impact of the power of communication, and especially as oncologists, how we communicate with patients. In the field of oncology, there's really two bad words, and they're both C words: cancer and chemotherapy. Even when pronounced correctly, with empathy, these words bring up feelings of overwhelming emotion, fear, despair, and shock. It's difficult to expect someone in that situation to really absorb technical details, much less understand the plan of action in a state of shock when we're talking to them. So when we discuss life-altering factors with cancer patients, about their diagnosis, their staging, their treatment plan, of course we're taught to do it with support, empathy, and appropriate medical education. But we make a major speculation when we assume patients understand that information in the same way that we do, even with good intentions, when revealed in the wrong tone, the wrong body language, the timing. What I say may sound just as confusing to a patient as it did to George Clooney when this flight attendant asking him, a seemingly simple question during beverage service. So some of the lessons we can learn, for all clinicians, by the way, not just oncologists: speak slowly and earnestly, enunciate words, simplify the language, especially medical terminology, by culture and education level, pause frequently, and allow or even insist on moments of silence. Listen, learn to be comfortable with that silence, hear what's not said. I once had a mentor who showed me how to deliver information in this way. After revealing the diagnosis, the staging, the treatment, he always paused and he said, "Ask me some questions," to that patient. He didn't say, "Do you have any questions? Ask my nurse on the way out. I'll see you next time." He says, "Ask me some questions." And this allowed the patient to have the stage, to air it out, to express any understanding or misunderstandings. And this method helped to iron out any confusion, misconceptions, or even disagreements. The other thing is, you don't have to get it right all out at once, all out in one visit. We can discuss difficult issues over time, introducing and reintroducing difficult conversations, especially those like prognosis, over time, allowing time for processing, for people to understand. In doing these things over and over, we can defeat fear with empathy. And maybe in the end, we can empower, share, and even split a journey of cancer together with our patients.